This presentation is designed to inform the viewer about the disability classification term Other Health Impairments, or OHI, which is listed as one of the 13 disability categories under the Individuals with Disabilities Education Act of 2004. According to the IDEA Act of 2004, other health impairments means having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli, that results in limited alertness with respect to the educational environment that is due to chronic or acute health problems and adversely affects a child's educational performance. OHI is an umbrella term encompassing a large number of different health conditions. The common thread throughout all of these conditions is that they affect the student's physical abilities and often limit the student's alertness in the classroom, which in turn influences his or her academic performance. Some of the many health conditions that fall under the disability category of OHI include asthma, blood disorders, childhood cancer, congenital heart defects, cystic fibrosis, diabetes, sickle cell anemia, tuberculosis, hepatitis B, HIV/AIDS infections, epilepsy, and attention deficit disorder. Asthma is a respiratory condition that can cause coughing, wheezing, and shortness of breath. Cystic fibrosis is a lung disease which can cause excessive mucus to build up in a person's airways. Both conditions cause uncomfortableness for children and can lead to difficulty concentrating in a classroom setting. Diabetes is a blood disease which requires active monitoring of the student's intake of insulin. Congenital heart conditions are heart defects that are present at birth and come in many forms and levels of severity. Among many considerations a classroom teacher must have for students with diabetes or congenital heart conditions is chronic fatigue. Tuberculosis is a disease caused by a bacteria that attacks the lungs. Childhood cancer is different from cancer in adults. The cancer can occur suddenly and without any early symptoms. To help children with cancer succeed, educators can include the student as much as possible in activities and not treat them any differently. Blood disorders can be either acute or chronic. One or more parts of the blood are affected with blood disorders can prevent your body from doing its job. HIV is a virus that damages the body's immune system, which can result in AIDS. With both conditions, teachers must be aware of how they can affect children's learning. Hepatitis B is an inflammation of the liver caused by a virus. Infected mothers can spread hepatitis B to their babies at birth. Storch infections are fetal infections that can cause birth defects. Understanding how these conditions can limit the student is important for all educators to know. Other health impairments are considered low-incidence disabilities. Approximately 62.4% of students with OHI were included in general education classrooms. Students with other health impairments fall into two categories, those with chronic illnesses and those with infectious diseases. Asthma is considered the most common and chronic disorder.
Every student is a unique individual and each one uses their own learning strategy. The goal of inclusion classrooms is to ensure that each and every child receives the attention and support they need to achieve both academic and socio-emotional success. The classroom teacher must be able to recognize the physical and mental limitations as well as the capabilities of each student. There are many accommodations and strategies that a classroom teacher can take to provide support for students with disabilities that fall under the classification of OHI. Classroom teachers must strive to create a caring, nurturing, and safe environment for all students. Accommodations for students with OHI include providing the physical space for movement and the incorporation of strong visuals placed throughout the classroom to reinforce procedures and expectations. Additional accommodations include frequent check-ins and allowing rest breaks. The length of assignments can be reduced and alternative assignments and grading scales should be employed to account for students who are often absent. Providing assistive technology for students with OHI is also an important accommodation. An assistive technology device is any item, piece of equipment, or product system that is used to increase, maintain, and improve the functional capabilities of students with a disability. Some examples of assistive technology are low-tech items such as pencil grips and higher-tech items like laptops, voice recognition software, and wheelchairs. Other strategies for teachers of students with OHI disabilities include encouraging group work and cooperative learning to promote interpersonal skills and hands-on learning to provide a tactile experience. Ample opportunities for visual learning should also be provided. Students with OHI may have difficulty focusing on their education due to their healthcare needs. Students often face obstacles that impact their learning. Depending on the health condition, students may be frequently absent from school, struggle with paying attention, or have physical restraints. Side effects and other difficulties faced can be caused by medications and treatments or by the health condition itself. These side effects make it hard for students to attend school regularly. Homebound or hospital instruction provides an opportunity for students with OHI to maintain their studies by having a teacher come to them. Due to all of the various conditions that fall under OHI, there is not just one way to help these students. As stated previously, several supports can be put in place to help students with OHI succeed in school. It is the educator's job to ensure this success. Other health impairment is a disability category that includes many different health conditions and diseases. What accommodations will you provide to help students with OHI in your classroom?